Dr. Suri, what are the unique features of IPA Diabetic Foot Conference?
These IPA Diabetic Foot Conferences are what we do since the last 10 to 12 years we are doing. These are mainly not in the conferences, these are mainly workshops we do. It's a hands-on workshop where we teach the doctor how to do debridement. Even physicians and general physicians and diabetologists, they are able to do debridement on the foot. Like we teach them how to take care of the dead skin, how to remove the calluses, corns, and they can take the scalpel and remove that on the patient, not to be scared of in doing the debridement. We teach them how to early diagnose neuropathy and peripheral vascular disease. Then we have a special session on diabetic foot infections, what type of bacteria to hit the patient with that, gram positive, gram negative or anaerobic infections are there. Then we have a special session on peripheral neuropathy, what are the latest equipments, how to diagnose patients with peripheral neuropathy, how to use 10 gram monofilament, biothiometer, then vibratometer, and then do the prognosis, whether the patient is relieving on the medicine he is taking. Then we do a special session on PRP and VAC therapy, which are new techniques, how to heal bigger wounds where infection has gone to the bones. Sometimes we are using dermal matrices like Dermacell, Metriderm, we have Integra. So these type of special techniques are used to heal the wound, mainly on the sole of the foot, where we don't have much fat pad tissue. There we need to use these dermal matrices to use that. Then we do a special session on offloading, like when the patient is there, how to offload our foot. Forefoot ulcers, rocker bottom soles, hind foot shoes are there, mid foot soles are there. Then 3D scanning, we can make the patient to walk and do the 3D scanning. And then we teach the doctors how to incorporate that 3D scanning from the computer into an insole. We can give the insole inside the shoe of the patient. Like a lady is there, she can use those orthotics inside their bellies, inside the sandals or chappals they are going to work. Or if it's a gent, he can use that inside the shoe of the patient. We can do these 3D scanning and custom made orthotics. We teach them how to develop these custom made orthotics. So these are unique features of Indian Podiatry Association. Now, when the patient is there who has got peripheral vascular disease or he has gangrene in the feet, and then we refer these patients to vascular surgeon. Vascular surgeon, as we do angiography of the feet, similarly angiography of the leg is done. And then ballooning is done, where we can endovascular procedures by which the blockage in the arteries is opened up, so that more blood flows to the feet of the patient, so that we can early heal those patients. Sometime even after doing the endovascular procedure, we see that wound is not healing or proper circulation is not there to the feet. In those cases, we do stem cell therapy. Stem cell is a unique technique now. It's a latest innovation where we take patients' blood, we send them to the stem cell bank, and those stem cell bank, they make the cell lineage and multiply those cells into 25 million cells. And those 25 million cells we inject along the anterior and the posterior tibial artery in the leg of the patient, and with that healing starts into that. Then there's another technique called nail surgeries. Lot of time patient have paronychia, ingrown toenail. Lot of children, they do come to us with the problem in the nail. They have onychomycosis, they have fungal infections in the nail. So we teach them how to do nail surgeries, how to take care of the nail, how to debride these nails, take care of the fungal infection in the feet. Then there's a technique called fat pad tissue, where in fat pad we can take fat of the own patient from the back, from the side of the breast region, and we can inject that in the foot of the patient. So that takes a fat pad restoration. That's also a unique technique which we teach our Indian Podiatry Association members or delegates who attend these conferences. We are doing about 4 conferences every year in one of the hotels where we are standing now, and other parts of the country. Last year we did one big meeting in Hyderabad, workshop like this. Then 2 meetings we did in Mumbai. One we did in Orchid and one we did in Marriott in Mumbai. Then one we did in Amritsar. And we keep on doing. This year we are planning one in Chennai, one in Mysore just 2 weeks from now. One we are in September, we are planning in Manipal University, that's a big meeting there. One we are planning in Surat, Indore, Ajmer, then Lucknow, Ludhiana, Jalandhar. So like that, we have 17 states of Indian Podiatry Association. So every state we do one workshop per year, so that the members in those states are aligned, and they are aligned, and they can get experience from there. Also, one of the unique features of Indian Podiatry Association conferences is that we get international faculties also. We have doctors from USA, doctors from UK who are our members, or we get these members from outside. They come and on webinar also, and now physically. During COVID, we were doing a lot of webinars with international faculty, but now we are getting them physically come during our conferences and attend these meetings and share their experience with our doctors. So I think everyone should get whoever is dealing into diabetic foot care, they should become members of Indian Podiatry Association, and they should attend these conferences and workshops so that it's an enhancement of their knowledge, whatever they are doing and whatever you are doing, so you can enhance your knowledge and save people from amputations. Thank you.
I'm sure, Dr. Suri, with such unique features, IPA Diabetic Foot Conference would be successful. Thank you so much.